PSY 310, Study Section 9. Movements. Introduction. In this lecture, you will gain a greater understanding of how our nervous system commands us translated into movements. Even if we don't have the natural ability and dedication to reach the pinnacle of athletic performance, our muscles usually do a good job of getting us around and carrying out skilled movements. Objectives. At the end of this lecture, you should be able to 1. Identify muscles. 2. List the type of muscles. 3. Describe the neural control of muscles. And 4. Explain the disorders of movements. Content. Muscles. Muscles make up the majority of the human body tissues and are responsible for the movements of the body and the movements of materials within the body. Types of muscles. Muscles can be divided into smooth and striated muscle based on their appearance. Smooth muscle is found in the lining of the digestive tract, within the arteries, and in the reproductive system. Smooth muscles move nutrients through the digestive tract, control blood pressure, and mix sperm with seminal fluid, among other tasks. The smooth muscles are controlled by the autonomic nervous system. Striated muscle is named after its striped appearance. There are two types of striated muscles. One is the cardiac muscle and the other is the skeletal muscle. The tissue of the heart cardiac muscle composes. Skeletal muscle that is attached to bone produces the majority of body movements, while other skeletal muscles are responsible for moving our eyes and lungs. Skeletal muscles are made up of long, very thin cells, referred to as muscle fibers. Human muscle fibers usually extend the length of the muscle and may be up to 30 cm long and from 0.05 to 0.15 mm wide. Cardiac muscles keep our hearts beating. Skeletal muscles move our bones, eyes, and lungs. The contraction of a single muscle fiber can occur, and this is referred to as a twitch. Exercise can build muscles. In many cases, muscle enlargement is desirable. However, enlargement of the cardiac muscle often results in life-threatening heart disease. There is a case of loss of muscle mass, which is as a result of aging, which begins as early as age 25 and accelerates through the remainder of the lifespan. By age 50, most people have lost at least 10% of the muscle mass they had at age 25. The interaction of muscles at a joint. Muscles can only do one thing, and that is to contract. The contraction of a single muscle can either straighten or bend a joint, but not both. As a result, muscles are able to pull a bone in a single direction but are unable to push it back. Relaxing the muscle will not necessarily cause a limb to move back to its original position. Muscles are arranged at a joint in antagonistic pairs. Muscles that straighten joints are referred to as extensors, and muscles that bend joints are known as flexors. To bend the nail, the flexor muscles of the thigh must contract, while the flexors relax. Movement of some joint is more complicated than a flexion and extension. Additional muscles are needed at joints, such as the shoulder, the hip, the wrist, and the ankle, to allow for rotation and other complex movements. Neural control of muscles. The contraction of skeletal muscles is directly controlled by motor neurons, originating in either the spinal cord or in the nucleus of the cranial nerves. The alpha motor neurons are the spinal cord motor neurons, directly responsible for signaling muscle fibers to contract. The alpha motor neurons form highly efficient connections with muscle fibers at a location called the neuromuscular joints. While the motor unit is the combination of a single alpha motor neuron and all the muscle fibers that it innervates. Reflex control of movements. The spinal cord is responsible for a number of reflex movements designed to protect us from injury, to maintain posture, and to coordinate the movement of our limbs. We have the monosynaptic and the polysynaptic reflexes. These reflexes are present throughout the human lifespan. Disorders of movements. A variety of toxic substances interfere with movement by acting on synapses within the motor system. Muscular dystrophy. This is not a single disease, but rather a group of inherited diseases characterized by progressive muscle degeneration. Polio. This occurs only in human beings and is caused by a contagious virus that specifically targets and destroys spinal alpha motor neurons. The development of effective vaccine for polio in the 1950s drastically reduced the number of cases worldwide. Accidental spinal cord damage. The spinal cord may be accidentally damaged when the protective vertebrae surrounding the cord are broken and compressed or sever the cord itself. This tragic accident generally results in permanent paralysis of the muscles served by neurons below the level of damage. If the damage occurs in the cervical area or neck region of the spinal cord, the person will experience quadriplegia or the loss of movement in both arms and legs. If the damage occurs in the lumbar region of the lower back, the person will experience paraplegia, the loss of movement in the legs. Amyotrophic lateral sclerosis, Lou Gehrig's disorder. ALS results from the degeneration of motor neurons in the spinal cord and brainstem. The muscle served by these motor neurons degenerates when their input ceases. The cause of ALS is still somewhat mysterious. Parkinson's disease. Parkinson's disease is characterized by a progressive difficulty in all movements, muscular tremors in the resting hand, and frozen facial expressions. This system, tape 2. Parkinson's disease is characterized by a progressive difficulty in all movements, muscular tremors in the resting hand, and frozen facial expressions. These symptoms were first observed by the English physician James Parkinson in the early 18s. Patients with Parkinson's disease experience enormous difficulty, such as standing up from a chair. The disease produces a characteristically stooped posture. Patients' reflexive movements are also impaired, and they fall easily if they lose their balance. Treatments include surgery, medication, electrical stimulation, and fatal cell implants. Huntington's disease. Huntington's disease strikes in middle age and produces involuntary jerking movements. As the disease progresses, cognitive symptoms such as depression, hallucinations, and delusion may occur. There is no known cure for this disease, which strikes about 1 person out of 1,000. Summary. 1. Muscles make up the majority of the human body tissue and are responsible for the movement of the body and the movement of materials within the body. 2. Muscles can be divided into smooth muscle and straightened muscle based on their appearance. 3. Smooth muscle is found in the lining of the digestive tract, within the arteries, and in the reproductive system. Smooth muscles move nutrients through the digestive tract, control blood pressure, and mix sperm with seminal fluid, among other tasks. The smooth muscles are controlled by the autonomic nervous system. 4. Striated muscle is named after its striped appearance. There are two types of striated muscle. One is the cardiac muscle and the other is the skeletal muscle. 5. The tissue of the heart composes the cardiac muscle. Skeletal muscle that is attached to bones produces the majority of body movement, while other skeletal muscles are responsible for moving our eyes and lungs. 6. Skeletal muscles are made up of long, very thin cells, referred to as muscle fibers. Human muscle fibers usually extend the length of the muscle and may be up to 30 cm long and from 0.05 to 0.15 mm wide. 7. Cardiac muscles keep our heart beating. Skeletal muscles move our bones, eyes, and lungs. The contraction of a single muscle fiber can occur, and this is referred to as a twitch. 8. Muscles can only do one thing, and that is to contract. The contraction of a single muscle can either straighten or bend a joint, but not both. As a result, muscles are able to pull a bone in a single direction, while unable to push it back. 9. Relaxing the muscle will not necessarily cause a limb to move back to its original position. Muscles are arranged at a joint in antagonistic pairs. 10. The muscles that straighten joints are referred to as extensors, and the muscles that bend joints are referred to as flexors. To bend the nail, the flexors muscle of the thigh must contract, while the flexors relax. Movement of some joints is more complicated than flexion and extension. Additional muscles are needed to joints such as the shoulder, the hip, the wrist, and the ankle to allow for rotation and other complex movements. 11. The contraction of skeletal muscles is directly controlled by motor neurons originating from either the spinal cord or from the nucleus of the cranial nerves. 12. The alpha motor neurons are the spinal cord motor neurons, directly responsible for signaling muscle fibers to contract. 13. The spinal cord is responsible for a number of reflex movements designed to protect us from injury, to maintain posture, and to coordinate the movement of our limbs. 14. We have the monosynaptic and the polysynaptic reflexes. These reflexes are present throughout the human lifespan. 15. Muscular dystrophy is not a single disease, but rather a group of inherited diseases characterized by progressive muscle degeneration. 16. Huntington's disease strikes in middle age and produces involuntary jerky movements. End of study section 9. Thanks for listening.